Are you keen to improve your health holistically? Are you affected by obesity, type 2 diabetes, prediabetes, or lifestyle disorders and are looking for a solution? Find out more in this series. Hi, I'm Nitin Dua and I'm delighted to welcome you here. Do you know 1 in 10 people globally are living with diabetes? This is as of 2021. And this number is going to go up to 1 in 8 by 2045. This is coming from IDF, which is the International Diabetes Federation report. Typically, 90% of these diabetes cases are type 2. I'm going to bring in two examples of leading countries here, the US and India, where I have also spent a lot of time working and living. In the US, 1 in 3 people are living with prediabetes. What's even more shocking to me is 8 out of those 10 people are not even aware of this. 1 in 8 adults are living with obesity globally. And this number is coming from WHO. Similarly, for India, the numbers of obesity, diabetes, prediabetes, lifestyle disorders are in millions. Are you someone who is currently either struggling with this or care for someone who is struggling with obesity, diabetes, prediabetes, or any of the lifestyle disorders and are looking for a solution to improve your health and the quality of life? Or you're someone who's looking to improve health holistically in an integrated preventative way to open up to multiple possibilities and shift your perspective? Then this video series could benefit you. I'm going to offer 3 viewpoints here. The first one coming from personal experience, the second one coming from experience of helping my family, friends and community members and people who have come in my life, and third, experiences of my professional experiences and academic foundation over the last 15 plus years at the intersection of health and technology. You know, in an earlier phase of my life, I was morbidly obese, BMI of roughly 30 odd, weighing 200 pounds, almost 90 odd kilos. And if I tap in my feeling tired and feeling less confident at times. Later on, in another phase, I was feeling unproductive and overthinking, being stressed and anxious at work. Not only I'm grateful to overcome that, but I'm truly blessed to be able to transform myself within and open up to multiple possibilities. And that's what I see as health being a very integral, fundamental pillar in my life. I'm also very grateful to have the good fortune of helping people in my life with obesity, type 2 diabetes, prediabetes, and lifestyle disorders. And truly grateful to collaborate with several leading clinicians, scientists, researchers, and engineers, and many more across the globe. Speaking of my professional experiences, if I talk about the last 15 plus years at the intersection of health and technology, I started out as a medical researcher at Stanford Medicine, where I also did a master's in electrical engineering at Stanford University. I did research in brain, AI, cognitive systems, and neuroscience. And I was also fortunate to collaborate with BioX, which worked with Stanford hospitals and also partnered with AIIMS, the leading clinical hospital in India. This exposure at the intersection of health and technology unfolded in multiple facets in my life. I'm co-founder of Hilfi Tech in health space. I've also been blessed to be ex-COO of SAG and Whipple MedCorp. And I've also been lucky to partner with several leading companies like Twin Health, which is working on remission of type 2 diabetes, and Innovacer, which has got on to become a 100 million revenue company, which also works in care coordination for people with metabolic disorders and people with diabetes. I was truly blessed to get an opportunity to work with PricewaterhouseCoopers in the healthcare practice in the US, which also was helping the leadership teams of Fortune 500 companies in hospitals, insurance companies, biotech, medtech, with the government and the physician boards, and many more. And this really opened up the exposure and forming a point of view to look across the value chain. This layered with the personal experience that I shared, with the opportunity to help many others, is where I'm speaking from. And today I choose to speak from heart, not just my mind. I learned a lot from these experiences, from several failures, many successes, and several learnings along the way. that I'm truly grateful for, to be able to learn from these amazing people that have come in my life. Before I go further, I want to put out a small disclaimer. I hope what I'm sharing here is not construed as medical advice. For medical advice, you should consult your doctor or physician. What I'm sharing here is in my experience, and I have learned from looking at my experience and looking at data of others. What's worked for me may or may not work exactly for you. But the only way to find out is to experience it for yourself. You could choose to see me as a coach if that's what you need additional support with. So the next thing that comes to my mind is, why talk about this now? Besides the number being alarming, the rate of change is alarming as well. For obesity, in the last 30 odd years, the numbers have doubled as per WHO for adult population. For adolescents, that number has gone 4x. This does not just end with an individual, it also ends up impacting the families, the communities, and the countries, and there is a significant cost burden. Obesity is a strong risk factor to premature death. Diabetes is a leading cause of death, often leading into the causes of kidney issues and heart issues. Speaking of death, I lost my loving mother in February 2024, recently, in a matter of a few days. Gone in a jiffy, as my daughter calls it. She had a cardiac arrest, and underlying she had type 2 diabetes and many other conditions that she was struggling with. But what I feel is, because of type 2 diabetes in the system, it really amplified the issues at hand and really limited the recovery process. As we saw with many of our loved ones in COVID, people who had diabetes or other lifestyle disorders were at a significant high risk factor of death when COVID struck. So the way I see it is, diabetes type 2 in the system acts like a slow poison and slowly kills the body from within as a silent killer. And similar things for obesity, prediabetes, and other lifestyle disorders. I feel the urge to raise awareness about this more strongly than ever before. I'd like to do my bit to serve one more human be healthier, hopefully nudge you in the right direction and empower you with the right information to take action and open up to multiple possibilities in your life. And I'm truly grateful for that. As I tap in my feelings, I feel truly blessed to be able to share this journey with you. And honestly, it's been a journey for me to get here. I feel very thankful, very excited, and look forward to helping you in your journeys. I look forward to hearing from you with your comments, with your feelings, with your questions and feedback as you have any. Health is simply a top priority for me, and I hope you would consider making it a priority for yourself, if not already. I see myself as a better version every day and a WIP in health. Not just a work in progress, but looking at it holistically, integral, preventative way of health. And there are several underlying pillars for that. Some of them being the mental health pillar of nutrition, another pillar of physical health, of spiritual health, and many other such pillars that I'm going to unpack in the upcoming videos. One perspective I want to leave you with to reflect on is to watch your belief system. In my experience, self-belief is a game changer. So please start with that if not already. I know you can do this. I'm not going to say that it's going to come easy or looking for any shortcuts, but from my experience, it's totally worth it. What's gone past is not in our hands. This is day one for the rest of your life. And I hope you make it count and start taking action. Thank you so much for listening in to me. I also want to take a moment to thank God, my family, my friends, my coaches, and my teams. It's these amazing individuals and giants whose shoulder I draw inspiration from, and I'm truly grateful for it. In the upcoming videos, I'll unpack type 2 diabetes, prediabetes, obesity, the root causes and symptoms, and much more. I will also unpack the holistic, integral, preventative approach to health that I started to uncover in various pillars. If you have found value in this conversation, I hope you would consider hitting subscribing and sharing it with others who could benefit. I look forward to seeing you all in the next video. Until then, this is Nitin Dua, serving with love. Cheers.